The ABC 15 Health Insider continuing our team coverage now. If you do plan to get out of town, and especially if it involves cross-border travel, our team has a warning. ABC 15's Faye Fredericks explaining how your vaccine status could impact your ability to return home.
The sunny skies and warm waters of Mexico always a draw during spring break. But a new federal rule requires air travelers, even Americans returning home, to test negative for COVID. You'll need to test no more than 3 days before you travel by air into the United States and show your negative result to the airline before you board your flight, or be prepared to show documentation of recovery, according to the CDC. But what about your vaccination status? Could a recent vaccination trigger a false positive? We took that question to Arizona Medical Association President Dr. Ross Goldberg.
And that has been a confusing point for people because some people have heard that people get vaccinated and then they test positive for COVID. The reason they test positive for COVID is because they have COVID.
He says all the vaccines work by building antibodies to the spike protein on the coronavirus. So if you've had the vaccine, an antibody test will come back positive, but PCR and antigen tests will not.
The rapid PCR test that jokingly the brain biopsy where they swab your nose, that's a rapid test to look for the virus. And there's the antigen test, which is, again, signs of a rapid infection that you've been recently exposed. The vaccine doesn't cause either one of those to turn on.
The vaccines do not contain a live virus. In fact, they don't have coronavirus in them at all.
They have a piece of the mRNA that makes the spike protein. So it shouldn't trigger anything.
So travel smart and travel safe and get vaccinated as soon as you can. Faye Fredericks, ABC 15, Arizona.
If you have a question or a story that you want our Health Insider team to look into, just send us an email to healthinsider@abc15.com.